Welcome to the Healing Grove podcast. I'm Dr. Kristin, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Welcome everyone to the Healing Grove podcast. I'm super excited today to introduce you to one of my mentors, Dr. Neil Nathan. Neil Nathan, MD, has been practicing medicine for over 50 years. Let that land for a second. For over 50 years, longer than most of you have been sick, he has been treating people like you with the kinds of symptoms and syndromes and mystery illnesses that you guys have. So it's a real gift to be able to pick his brain today. He's been board certified.
So you're saying I'm really old, is that right?
I mean, I'm saying you're really wise. I'm saying you're super wise. You're like a wizard. You're like Gandalf, okay? The white beard tells me that you've achieved like next level wizard status. So that's what I'm saying. I aspire to white hair someday. And I want to say that you were kind of the doctor I was looking for all through medical school, Dr. Nathan. You were the guy I was looking for who would be like, I've been here for 30 years. I know what this looks like. I can teach from this place of deep wisdom. So yeah, old to me is like not a bad word. It's kind of what I've always been looking for. So let me get back into the introduction if you don't.
Sorry to interrupt. I couldn't pass that up.
Do it again as you have to. You've earned that with your white whiskers. So for over 50 years, board certified in family practice and pain management, and a founding diplomate of the American Board of Integrative Holistic Medicine, as well as of the International Society for Environmentally Acquired Illness. So if you need one more reason to know why I'm so grateful to you for all that you've done, as a board certified person in integrative and holistic medicine, that wasn't around when I was in residency. You were like busy working on that when I was kind of coming up through my training. And it's just so nice to have a body of doctors and practitioners that's recognized and board certifiable now. So thank you, if I forget to say it later, for all the work you've done to legitimize and bring kind of a pathway forward for people who are learning how to be integrative doctors.
You're welcome.
Thank you. He's also a pioneer in the treatment of complex chronic illness, having seen patients for so many years. Over the last decade, really focusing on bringing awareness to the role that mold toxicity plays in these varied conditions. To that end, he's written several books, including Healing is Possible, New Hope for Chronic Fatigue, Fibromyalgia, Persistent Pain, and Other Chronic Illnesses, and On Hope and Healing for those who have fallen through the medical cracks. He's also established, along with Dr. Jill Krista, another of my mentors, a mentorship program for practitioners, which I'm honored to be a part of. And he lectures widely and internationally to physician groups, spreading the word about how to diagnose and treat these increasingly common inflammatory syndromes. His book, Toxic: Heal Your Body from Mold Toxicity, Lyme Disease, Multiple Chemical Sensitivities, and Chronic Environmental Illness, is a bestseller, and one that I not only recommend to patients, but hand out like candy to any medical student I meet, because I feel like it's required reading for the next generation of doctors. His new book, The Sensitive Patient's Healing Guide, is another winner. It's like the book I fantasize about every time I'm at one of these conferences with all of you smart people up there lecturing. I'm like, I wish I could download this into a document for all my patients. Thank you, you did it. It's right here. It's amazing. And now I'm recommending that to all my sensitive patients. So we're going to talk today about the sensitive patient and about how to recognize and understand what's happening in people who become sensitized to common things like food and air and sunlight, so that people can have a pathway out of that. So thank you so much for being here. As you can tell, I'm super excited for this conversation. And I want to hear from you, Dr. Nathan. First of all, what led you to this pathway? Most people who are on this path, like you and me, I think, have been touched by someone who was ill with these mystery illnesses. And I wonder if you'd be willing to share with us kind of how you found your way to this place.
Yeah, my path is different than most. I didn't come to it by either being ill myself or having a loved one who was sick, and so I had to figure out how to help them. I started out wanting to be a healer. Um, and so I was really disappointed when I got to medical school that when I realized they weren't going to teach me to be a healer, they were going to teach me how to be a medical technician. Now that's useful, that's great, gives me the credentials to do what I do now. But I realized pretty quickly that I was going to get disappointed. That's not what things are about. Now, this is a long time ago. I started medical school in 1967. So this is before the word holistic was a word. And I would keep telling my professors, there's something missing in what you're trying to teach us. And they would say, okay, wise guy, what is it? And I'm going, I don't know. I'm a first year medical student. I just know that there's something missing here. Don't know what. So many, many years later, I have the language to tell them what was missing. It was missing the spiritual, emotional, energetic component of illness. It was simply focused on anatomy and physiology and pharmacology and helpful, but it doesn't allow you to see the bigger picture. So I spent the rest of my entire life looking for more answers. I studied with anyone who had anything interesting to offer. I wasted a lot of money on people who said they did and didn't. But I also had the phenomenal blessing of meeting and working with some of the greats in the field who taught me a tremendous amount and kept pointing out the path to how do you learn more. So I studied emotional release, spiritual techniques, acupuncture, homeopathy, osteopathic manipulation, um, therapeutic touch, laying on of hands, shamanism, um, anything that looked interesting. I was there, kind of eating it up. Now, that's a long-winded way of explaining that everything that I learned, I found would apply to some patients. So that with each thing that I learned, I had another tool for my toolbox so that when someone came in with a complicated problem, rather than go, sorry, can't help you, I went, oh, I think I might have something that could help you here. And I've been doing that for over 50 years. So that's kind of how I got where I am. Along the way, I got a reputation for being interested in those people who are outliers, those people who my colleagues didn't know what to do with, they couldn't help. I just was interested in them. I kept thinking, there's got to be some information available to help these folks. And very slowly, I began to combine what I was learning with being able to begin to help some of those folks. And as we've learned more and acquired more information, my practice consisted of essentially those patients who were so complicated that even people in the holistic health field weren't sure what to do with them. So they were very sensitive, very toxic, and it forced me to learn how to understand what they had so I could help them. So again, long-winded way of saying, I got here because I really wanted to help people and I needed to get tools and learn things that weren't part of conventional medical education.
Yeah, it's there's a lot I can resonate with a lot of that. Was there ever a point at which you were like, wow, I just found the thing that I wish I'd studied from the start as opposed to going to medical school? Because medical school is such a long road, you know?
Everything. Everything. If I had made one choice in medical school, I would have gone to an osteopathic medical school rather than to an MD medical school, because then I could have learned the osteopathy while I was going to medical school, and I wouldn't have had to acquire that information later. That was a great journey, but that would be one thing I might do differently.
Yeah. Wow. So I'm curious to know, having seen patients over 5 decades, if you see any trends or any differences in the kinds of sick patients who are kind of showing up in doctors' offices now with these complex mystery illness, mystery symptoms versus the ones at the beginning of your career.
Yeah, I don't think I was seeing the kind of illnesses then that exist now. By then, fibromyalgia wasn't a word then. Chronic fatigue syndrome wasn't a word then. We didn't know anything about Lyme disease or mold toxicity. PANS wasn't a word then. Autism was thought to be a genetic issue and is nothing like the epidemic that we're seeing of all of these illnesses. So, have patients gotten sicker and more complicated over the years? Absolutely. And I don't think that's just a selection bias. I think there's no question that the world that we live in has gotten so toxic. And by toxic, I mean heavy metals, chemical pollutants, EMF exposures, that we just live in a sea of toxicity that has never before been on this planet. And um, what we're seeing is, I used to call them canaries in the coal mine, but they're not canaries anymore. It's now flocks of birds in the coal mine are being ill right now. So we've seen, again, an exponential increase in the sensitivities that are so important now. Um, I would occasionally see a sensitive patient years ago, but then it exploded by mid 90s. By 2000, it was really on our doorstep. Um, the autism, as we know, exploded so that 1 in 35 births in many states have autism. Fibromyalgia and chronic fatigue, we're talking 5 to 10 million people in this country with each of those conditions. Lyme disease, CDC just recently announced that there are 675,000 new cases every year. Mold toxicity, it's estimated there are 10 million. We're not talking about something that, oh, you won't encounter it if you live a nice, healthy life. We're talking about your family, your friends, your neighbors. Almost everybody's got some of these things. Autoimmune illnesses have exploded. Diabetes is rampant. It's thought that 20%, 25% of the population has either pre-diabetes or diabetes. So we're not talking about a minor, rare genetic process here. We're talking about a humongous increase in all of these diseases and their uh, complicated interactions.
Yeah. And for some of the listeners, they might be saying, well, that's a bunch of different, chronic diseases, but how can they all be related to toxicity? Could you speak to that? Because I think that's an assumption that's not maybe commonly held in the mainstream.
Yeah, I think what all of these things have in common, and I've left out neurodegenerative diseases like Alzheimer's and Parkinson's and ALS and things like that. All of these things have in common inflammation. That is the single thing that ties them all together. And what we're learning is whatever is triggering this inflammation has different effects depending on the age at which it occurs. So if we're dealing with a newborn or a young child, that inflammation will affect them to get autism or ADHD or something on that spectrum. If we're dealing with a somewhat older person, they will present with fibromyalgia or chronic fatigue-like issues. And if we're dealing with a yet older person, that will turn into a neurodegenerative process. So what looks like different illnesses is the same illness that is simply spread across our age range, depending on what we are more predisposed to. But the bottom line, inflammation. And whether inflammation is being triggered by toxins, mold being the most common, but by no means the only one, or infections, particularly stealth infections like Lyme disease and co-infections, chlamydia, pneumonia, mycoplasma infections, a wide variety of viral infections. All of these things share one basic underlying concept. They're triggering an inflammatory response that the body hasn't figured how to turn off.
So this gets into kind of the core of your latest book, The Sensitive Patient's Healing Guide. And I wonder if we could spend a little bit of time talking about how these toxins and this kind of ubiquitous amount of toxins can trigger sensitivity, like what that pathway looks like.
Well, there are three main interwoven connections in which this type of inflammation will trigger this type of sensitivity. And by sensitivity, just want to be clear, I don't mean it's being hurt by when someone says, you look fat in that dress. That's not the kind of sensitivity I'm talking about. It's the kind of sensitivity that is light, sound, chemicals, smells, touch, EMFs, and food. So the things that our senses are picking up neurologically, that's what we're sensitive to. And that has exploded. Now, there are three main components to that. There's a limbic component, there's a vagal nerve component, and there's a mast cell component. And all three of those components, one of them is cellular, the other two are neurological. All three of these interface with each other very, very intimately. It's not like, oh, I'll treat one or you just get one of them. When one is set off, almost all three come in along for the ride because they're so interwoven. So we probably need to talk about those three systems separately to understand them, but I really want to emphasize that they are completely interconnected.
So let's talk about the limbic brain first. There's been a lot of programs and talk, and I think awareness, which is great in the last several years, about limbic retraining and the ways in which the limbic brain can require some intervention, basically, so that people can overcome these conditions. Tell me a little bit about your journey with the whole limbic retraining world and sort of how you found your way to that and what you found to be useful for people.
In the early 2000s, I was seeing an increasing number of these very sensitive patients, and I didn't have much to offer them. I stumbled upon LDA, low dose antigen therapy, and that was helpful, but it took years for that to kick in and work and to reverse some of that chemical sensitivity that we were seeing. And then I stumbled on Annie Hopper's work, the dynamic neural retraining system, DNRS. And once I added that to those patients, we began to see profound recoveries. It was like, whoa, we're missing this big tool, and that involves the limbic system. Now, again, prior to that, I had a couple of other tools. Sometimes homeopathy would help some of my patients. Sometimes some osteopathic cranial work would help some of my patients. But it was hit or miss. It wasn't consistent. But the limbic work really opened it up and made a difference. And so after Annie, I recognized that Ashok Gupta was working along similar lines and developed his program for working his limbic system issues. And more recently, Primal Trust has entered the field, and I think it combines some of the best of both of those and adds some new components. So it's currently one of my favorites as well. So what's really important for people to understand is the limbic system's job is to protect you by scrutinizing the stimuli that you're being exposed to. And it's scrutinizing them particularly from the aspect of safety. Like, is that sound safe? Should I be reacting to it? Is that a gunshot or is it a car backfiring? Is it something I need to react to? Is it something I can just blow off? Is the light that I'm seeing too bright for me? I'm walking through the perfume aisle at Macy's and I'm really sick. Is that something I need to be paying attention to? I'm eating a certain food and I'm having these weird reactions to it almost immediately on consuming that food. So the limbic system is simply a part of the brain, and its job is to monitor these stimuli for safety. And if it doesn't think it's safe, it's going to let us know by using two main symptoms to tell us, hey, you're not safe. You got to stop doing what you're doing right now. They are sensitivity and emotion. So if a patient comes to me and says, I'm sensitive to either or all light, sound, chemicals, EMFs, food, touch, that's limbic by definition. If they also have or additionally have anxiety, depression, depersonalization, derealization, OCD behaviors, emotional outbursts, anger, irritability that they didn't before or is noticeably worse, that's limbic. And most of our patients have both of those to some extent. So they're literally telling us when they give us their symptoms, hey, I've got limbic dysfunction here. And if we don't address it early on in the course of treatment, the limbic system won't let you respond to the substances that you need to take for Lyme or mold that is triggering it in the first place. So it's a first thing. I've often heard people say, well, if I don't respond to what I'm doing, I'll come back to that later. No, you want to deal with that first so your body will allow you to treat yourself optimally. That's the limbic piece. And understand that that limbic piece has been evolving since you were in your mother's uterus. It didn't just suddenly happen that you got limbic dysfunction. None of us had perfect childhoods. So depending on what your childhood was like, whether you had recurrent ear infections and throat infections and went on antibiotics or needed surgeries of some type, or you had a family dynamic in which you were either abused emotionally, sexually, or physically, or simply ignored, or as your life moved forward, your limbic system was there trying to protect you every step of the way. It was trying to go, let's see, Dad's an alcoholic and he's coming home and I don't know what he's going to be like. So I need to stay away from him for my own personal safety. And so our limbic system has been increasingly hyper vigilant the older we get to deal with the world that we live in. And if we want to throw in, just for good measure, COVID, which scared everybody, and a worldwide panic set in that for some people it's still there. So now we have all of our nervous systems, not just ill people, but all of our nervous systems have been increasingly hypervigilant. And then you get the straw that breaks the camel's back, mold toxicity or Lyme disease, which adds, or COVID, which adds a huge outpouring of cytokines, which are chemicals that the body makes to try to deal with this kind of inflammation. And we're off to the races. So that's the limbic piece.
I think it's important too to understand that all threats can be equal to the limbic brain. I saw people who had a load of pathogens, a load of mold exposure, all the sort of usual suspects, but they weren't sick until not getting COVID, but the whole fear from COVID hit, right? The world shut down and people tanked. People just tanked. It's like they just decompensated. They've been compensating, and suddenly that was like the straw that broke the camel's back, the fear.
Yeah, I say that I kind of have 2 points to make because it's a very important thing. Many people have had exposure to Lyme or co-infections, but if their immune system is strong enough, they could have dealt with it for years and not either been sick at all or mildly didn't bother them. They could have been exposed to mold and it wouldn't have bothered them. But if their immune system takes a hit, and that could be a stressor, an infection, surgery, a traumatic experience in their life, some kind of hit, then I call it the straw that breaks the camel's back. And then the immune system loses containment and we're off to the races. Another important point that I can make here is a lot of folks who got COVID or the vaccine for COVID have had a prolonged illness afterwards. And we call that long haul COVID. It exists, it's a very real thing. But many of the people who think they have long haul COVID with its inflammatory cytokine storm unmasked underlying mold and Lyme. So a huge percentage of the folks who we're treating for long haul COVID are unaware of the fact that they really have Lyme or mold, which we can diagnose and treat. And in fact, we're finding that in those folks, if we make the right diagnosis and we treat them, we can help them, and they don't have what they thought was long haul COVID.
Yeah, yeah. Which gets to, and we'll come around to this at the end, a place where a resource for people who are looking for a doctor who understands this, because, you know, I see these long COVID clinics springing up in hospital systems, and I just don't have a lot of faith that they're actually going to be looking for root causes for why this person at this time got so hit by COVID, and what could it could have sort of unearthed for them. So we'll share some resources.
Yeah, they're not looking for root cause. There are clinics at every major medical center in the country now that's a mast cell clinic, and they're not looking for causes. They're under the impression, which is unfortunately mistaken, that these are standalone illnesses, and they're not. They're being triggered by something else, and we can diagnose that and we can treat that, but not if you're not looking for it. So I think, forgive me, they're very short-sighted and very lost in what they're trying to do for people.
Yeah.
I will say that there is a test that people can do to discover whether they truly have long haul COVID, and that's Bruce Patterson's cytokine panel through radiance labs, in which he measures 14 different cytokines, and the pattern tells him whether they truly have long haul COVID or not, which can be quite useful because there is specific treatment for long haul COVID. He's also recently realized that that same panel can distinguish long haul COVID from Lyme disease, so that there's a completely different pattern for Lyme disease. So by measuring these cytokines, we can actually get a clue. And I'm just very excited that I talked with him just last week, and he is hot to evaluate mold toxicity from the same perspective, so that we're about to launch into a research program so that that same panel, I believe, will help us to quickly tease apart mold, Lyme, and long haul COVID, with the understanding that many of our patients have Lyme and mold, so that we'll need to know what that pattern looks like too.
That's fascinating. I had no idea they were working on that. I guess one other thing that I would ask though is, so for the pattern that is specific to long COVID, or what they're saying is long haul COVID, not Lyme, not mold, maybe in the future, is the thought that that's a persistent infection, like the virus is continuing to replicate, and that's what's causing the symptoms and the pattern in cytokine expression? Or is it maybe the spike protein that's still lodged on surfaces and in tissues that's causing the inflammatory response? What is the hypothesis there? Are you aware of that?
I am, but I suspect there's more. So I think the concept is that there is active virus replicating, triggering this persistent inflammatory response. And the reason I say that is the treatment that Dr. Patterson has put up, Maravirac and atorvastatin, which is a simply statin drug, has helped a significant number of people to completely reverse that illness. And I've had some patients get excellent response from it. So I believe that is a piece of it. But I've also had patients not get reversed on that same treatment. And I suspect what's happened is they've had a cell danger response triggered by that. And we have to fix the cell danger response, because the initiating event is gone and the body doesn't know it. It's still under threat. It's still reacting as if it's having that threat, and we need to learn how to reverse that. So I think there's a couple of things going on here.
Okay, well, that's the perfect segue back, I think, to the other two legs of the three-legged stool of sensitivity and developed. Can you talk about the next one?
Sure. I call it the trifecta of sensitivity: limbic, vagal, mast cell. And throughout this discussion, I'm probably going to repeat this multiple times. The vagal piece, the vagus nerve, and it isn't just the vagus nerve, it's the vagus nerve and the cranial nerves that are connected to it. But for simplicity, we call it vagal dysfunction. It's not just vagal dysfunction. It's a whole complicated nerve dysfunction. It's a different part of the brain than the limbic system, but the vagus and the limbic system work hand in hand, very enmeshed, because the vagus does the same thing that the limbic system does differently. It's looking for stimuli that are potentially threats to the body so that you can protect the body that way. And the vagus gives us different symptoms to help us be aware of, oh, don't do what you're doing. This is potentially something we have to protect you with. So the vagus nerve, first of all, controls digestion along almost the entire digestive tract. So any symptom, particularly constipation, but constipation, diarrhea, heartburn, reflux, abdominal pain, virtually any symptom that reflects the GI tract, the vagus has something to do with. It affects the heart rate and the pulse. So if patients have palpitations or POTS or things of that nature, that's an autonomic dysfunction triggered by the vagus nerve. Temperature dysregulation, weight gain, insomnia are all vagal issues because the vagus nerve plays a huge role in the autonomic nervous system. So again, a different group of symptoms are largely vagal in its nature. And when patients describe that, we go, okay, you've got a vagal piece too. And honestly, it's almost impossible to have a limbic piece and not a vagal piece. Just about impossible. One system may predominate with symptoms, but both need to be treated concurrently, because if both the limbic and vagal systems are hypervigilant and you only quiet one, not going anywhere. You've got to bring both systems down. So there's a whole bunch of methods that we can use to bring the vagal system back into balance. One of my favorites is some new devices that are called vagal nerve stimulators. There's a whole bunch on the market, and depending on how sensitive you are, you might go with a particularly strong device like GammaCore or Truvega, or a much gentler one like Apollo Neuro. My very sensitive patients have to go with the gentler device. They just get overstimulated by the other devices, which are helpful for other conditions, like migraine, for example. Then there's osteopathic cranial work, one of my favorites, very gentle, fabulous way to treat the vagus nerve and to quiet down the whole cranial nerve dysfunction issue. Another of my favorites is frequency-specific microcurrent, which is a device, medical device that uses very minuscule amounts of electrical current to reboot the vagus, and you can use it for mast cell activation. You can use it for helping the body to improve its ability to detoxify from all of the toxins, improve the functioning of the organs of detoxification, the liver, the gut, the kidney, the skin, the lungs, lymphatics. So it's a great device. And there's more, but the bottom line that I hope our listening audience will take in is we know how to reboot the limbic and vagal systems now, and it's critical that if you have any degree of sensitivity, you embrace those because they work. So this is not psychological. Very important. This is not psychological. This is neurological, and we need to literally reboot the nervous system. And the good news is we now know how to do that much more effectively than we did 20 years ago.
I love that you name that, because I think in the past, awareness of this is growing, and I think people still get gaslighted by their doctors and told they need to go to psych when they're, describing some of these symptoms.
So many people are told by their family or their doctors, if they're sensitive, which is toughen up, be strong. I'm not responding to that, and I live in the same environment, so tough it up. And it's like they do not understand what's happening to that nervous system, and that's not the answer. If you keep being exposed to things that your nervous system thinks are toxic to you, you will get worse. You're not helping anyone to tell them to toughen up. It's the wrong advice given by people who don't understand the physiology of what's happening here.
And it's insult to injury. It's one more reason to feel unsafe if you don't feel supported.
Yeah, I call it iatrogenic PTSD, which is a fancy word for your doctor is making you sick because they don't understand what you're experiencing. They're telling you it's in your head and it's not. And unfortunately, often your family members are listening to that doctor tell you that, and they're going, well, your doctor says it's in your head, so why should I be supportive of you? And now we are down the rabbit hole of spiraling. Um, those folks aren't heard, are dismissed, denigrated. Their nervous systems are getting worse from that experience. So unwittingly, their healthcare providers who are giving them bad information are absolutely making them worse.
Yeah. Yeah. It's so sad. Before we go on to the mast cells, which are the third part of the trifecta, I want to hear a little bit more about tools for the vagus nerve because a lot of people aren't going to afford a stimulator or want to put some machine on their neck. And I know there are some tools. Do you have favorite tools that you can teach people to do themselves to tonify or rebalance the vagus nerve?
There are, they don't work as well as some things that require some financial output. Now, the Apollo Neuro costs, I don't know, $200, $300. It's not that expensive. The Gamma Core is $1,800. So yeah, there are some super expensive things out there. So one of the first things we learned was that you could use gargling, singing, gagging as kind of gentle ways of rebooting the vagus nerve. In my experience, they don't even begin to work as well as the things I mentioned. So I tried to go with the things that I think are the best at it. There's a method that is very inexpensive, but again, it's not adequate by itself, developed by Stanley Rosenberg in his book, Accessing the Healing Power of the Vagus Nerve. At the back of the book, he has a series of exercises, which are very simple to do to help reboot the vagus. It's great. I love it, but it's only an adjunct. I don't think it's enough by itself to do the rebooting process. So
That's good to know. That's
so
helpful.
so there are other things that are out there. These vagus nerves have been, forgive me, beaten up. They just don't respond to a light reboot. They really have to be rebooted. And for some patients who are really sensitive, sometimes intravenous ketamine can be a way to do that rebooting process. Again, not always available, but very light dose IV ketamine is one of the most effective rebooting tools that I know of.
Wow. So I'm aware of the studies on ketamine and I have some patients who've gotten great results, but I wasn't aware of the connection between the use of ketamine and rebooting the vagus nerve. Can you explain that pathway?
It can reboot the limbic, vagal, and or mast cell system.
Really?
Yeah, really.
How does it do that? What's it doing?
Well, I think that's super complicated. I'll refer you to a chapter in my new book written by Andreas Grossgold, who specializes in that. We have a whole chapter on ketamine. If the body will let it, and at a very light dose, it's a very rare person who can't do it. If the body will let you take the IV ketamine, it's like taking a psychedelic. And in fact, some people use low dose LSD or psilocybin to do the same thing, microdosing of it. It changes the way your brain perceives the world. And it becomes, if you're in a safe environment when you get it, and that should be part of the process, it allows you to kind of be at peace or at one with yourself in a way that you haven't for a very long time. It kind of forces the brain to, I'll use the word relax, but it's bigger than that.
It's like
That's
radical safety.
that's the Cliff Note version of what it does. So if you can allow your body to experience that, it can all of a sudden go, oh, I'm not in as much danger as I thought I was. My body's been overreacting to that, trying to protect me, but still it's been hypervigilant, and I don't have to be as vigilant because this is a beautiful, wonderful world that I'm living in, and I need to remember to see that part of it also. So it has that capacity. It's quite unique.
Wow. It's like a little micro trip back to the womb.
If that was a safe place.
If that was a safe place for you. Okay,
That's
let's talk
right.
about the third thing. Let's talk about mast cells, because those little critters also are a part of this whole story.
Yes, yes, they are. Um, Again, we gradually learned that. At least in my learning, I started by learning about the vagal system. Then I learned about the limbic system. Then I learned about the vagal system from Steve Porges, who's revolutionized that work. And Steve and I wrote a chapter in the book on that as well. And just for listeners, Steve also has a brand new book out, which I love, called Our Polyvagal World. Steve himself is a researcher, and many of the things he's written aren't readily accessible by consumers. But he's a really smart guy, and he realized he needed to bring in someone who could write. And so he brought in his son, Seth, who is a world-class journalist. And Steve and Seth wrote this great book, Our Polyvagal World, which will explain how the vagus system evolves to be what it is. It's a really clear, easily read understanding of how all of us, especially having gone through COVID, probably need to do some vagal and limbic rebooting on a regular basis in order to function at our highest level on this planet. We're all bogged down by the stresses that we live under and go, well, I'm coping and I don't have time, so I'll just keep plugging along until your body grounds you when it can't. So I really, one of the things that I think our educational system needs a complete overhaul, so that one of the things that I think that all children should learn is how to reboot their limbic and vagal systems, and whether we call it meditation or relaxation strategies or stress. I don't want to put a word on it that will put some people off thinking like, well, I'm Christian, so I don't want any other influences in there. None of these are that. These are all basic ways where every human being needs to learn how to regulate their stresses and nervous system better. When better to learn it than when you're a kid and have a tool that will take you through the rest of your life. But I digress. Let's talk about mast cell activation for a minute. Mast cells are an immune cell that is present in every tissue of the body, and its job is to integrate the nervous system, the neurology, with the immune system, so that because the immune system is involved, there's a much higher concentration of mast cells in our body surfaces that are exposed to the outside world. Our sinuses, our throat, our gastrointestinal tract, those are particularly high in mast cells. And when mast cells get triggered by inflammation, infection, or toxins, when they get activated, that's the word we used for it, they begin to react overly to stimuli that they never reacted to before. And one of the most obvious ways we would see that is if you have an individual who responds to anything they eat. This is not food allergy. It looks like it, but it's not. To anything they eat, within minutes, of putting it in their mouth. That is, by definition, mast cell activation. Allergies take a bit longer to come on. Instantaneous, that's mast cell activation. And so when people get sweating, palpitations, brain fog, intestinal cramping, hives, itching, immediately after eating, their first thought is, what did I eat? What did that to me? Well, actually, it's the act of eating that did that to you. So that your mast cells were so activated at that moment. So drinking water can trigger it. And I know people go, that's crazy talk. How could drinking water trigger anything? If the mast cells are activated, drinking water can, and I have seen it multiple times. It's not that rare. But those people are being told by their family and doctors, that's crazy talk. That's not possible. Yes, it is. So that is a tip-off that, yep, you've got mast cell activation also. So, and again, we have ways of treating it. We have a whole category of supplements, both pharmaceuticals and botanicals that work really well to quiet mast cell activation. So the good news is, by the way, for the listening audience, everything we've talked about today is treatable. Okay, you don't have to be a victim to your illness. We can figure out what is doing this, and we can treat you properly, but the order of treatment matters, so that if you have a limbic or vagal or mast cell piece, you need to treat that first, or your body won't let you take what you need to take to get well. So for those of you who have found that you can't take the antibiotics you need to treat your Lyme disease, there's another whole step in there that you need to put. For those of you who have found that taking a modest amount of clay or charcoal or chlorella makes you immediately ill, your body's trying to tell you, no, you've got to do some prep work here so that your body will take that treatment and be able to treat what is triggering all of this in the first place. Because I don't want to lose sight of the fact that it is mold toxicity or other toxins, Lyme disease and co-infections are the most common triggers of limbic, vagal, and mast cell issues.
Really helpful. So a lot of people out there, I think, are probably feeling pretty validated because you've really shed some light on some of the things that people are experiencing that just don't make sense to a lot of doctors and a lot of family members. What would be a next step for people who wanted to learn more about this or work with somebody who could help them, guide them through this and help bring even more light and some tools for them?
Okay, so first of all, please read my new book, the Sensitive Patient's Healing Guide. There are 20 guest authors in my book who are all the top experts on all of this. So Steve Porges wrote a chapter with me. Rich Horowitz wrote a chapter with me. Ashok Gupta, Annie Hopper wrote chapters individually. Beth O'Hara wrote several chapters on mast cell activation and salicylate toxicity. There are other things that are less common, which we have learned in the last 20 years can add to the sensitization process. So I would really encourage you to read the book, really understand, okay, as you read each chapter, if it resonates to you and go, oh, I think that might be me, that'll give you something you can take to a healthcare provider who knows what they're doing. And unfortunately, that's not a lot. So, on my website, which is just neilnathanmd.com, I have listed a bunch of physicians from all over the country who and world who I have trained and I've worked with enough that I'm really comfortable that they really know what they're doing. I've got a whole mentorship program that you're part of, so that you've got to work with someone who really understands this whole bigger picture. Unfortunately, in the Lyme world, there are many Lyme doctors who just focus on Lyme. They haven't yet embraced the mold piece, which is huge, and they haven't fully understood this limbic vagal mast cell piece that is preventing their patients from getting better. So you need to work with someone who gets it. You may have to do some homework for that to happen. There are not, unfortunately, as many physicians as we need, but I'm doing my best to help train them.
Yeah, and thank you for doing that. You're really amplifying your impact on the world by working with practitioners. Do you feel like it's changing? I mean, if someone asked me this recently, like, it just seems like there are no Lyme doctors or no integrative doctors who really get this stuff in our area. And I said, yeah, I don't see others popping up, and so in my neck of the woods, I'm not seeing a difference. Are you seeing it kind of nationally changing?
Un poquito. um, there's more, but my work is apparently not done. So we have, working with a phenomenal naturopathic physician, Jill Krista, Jill and I have a mentorship program, which now has over 200 physicians and healthcare providers in it that are learning to do it. And we're trying to teach everybody what we know as fast as we can. There are more than we used to have. There's an absolute crying need for much more, because as the world is getting more and more polluted, we are triggering more and more ill patients faster than we're training doctors to deal with them. I think that's the reality. So are there more people who can do this? Yes, there are. But there's an incredible need for more. We're talking millions of people in this country who are really sick and don't know where to get their care from. So
Yeah.
there's a huge gap that needs to be taken care of somehow.
Yeah. Well, I want to say one last thing about your book. To me, it really felt as I was reading it like sitting in, the forum, or, some of the beautiful national conferences that get put on every year where integrative doctors like you and me collect and share our cases and our thoughts and what's working, because it's such an iterative process dealing with complex patients. You have to be willing to do, as you said, kind of listen to what calls you, lean in a little bit, and then find someone to work with on that thing, because there's not one right way for everyone, right? If there were, none of us would need a job anymore. Like, we'd figure it out and be done with it. It's so complex, and it takes such really a commitment to curiosity and willingness to try things and experiment on yourself to find your way out. And so this book is really kind of what I've been trying to create at all of these conferences myself by creating massive documents in everyone's lecture. It really brings together the best thinkers from around the world on these topics, which each of them could be a whole book and have been whole books, but you do a really beautiful job of, introducing each chapter, kind of contextualizing each chapter, participating in the chapters, and then weaving it all together such that if somebody really wanted to sort of use it as their manual for recovery from extreme sensitivities like the ones we've been talking about, it's a really doable thing, obviously with maybe some needing to lean into different practitioners along the way based on what they're learning. So I just want to direct people there, because it's going to be a game changer for a lot of people.
That's why I wrote it. I thought I had learned, it's interesting. It's presumptuous to write any book, especially about a field that is evolving as you write it. On the other hand, I didn't think there was anything like this in existence. So I just thought this is a starting point. But I wrote it because there are so many suffering people that don't have a place to start. And I hope that this would give them that starting point to be able to move forward with their health care. Because again, we've learned so much in the last 20 years. I always had that, I wish I knew then what I know now kind of attitude towards it. I could have helped so many more people 30 years ago if I knew what I know now, but that's not how it works here in the real world. We just do our best and still learning. There's still evolving this field. But I wanted to pick up on what you said about there's not one right way to do this. One of the better ideas I've had in my life was to invite Jill Krista to do this mentorship with me. I had already been doing a mentorship, but it was purely for physicians. And I realized that I wanted to give people more tools so that if we added the naturopathic approach to treating mold toxicity and Lyme and environmental toxins to my, I'll call it allopathic, although no one who knows me thinks I'm an allopath. I thought that would be a much more comprehensive way of teaching this. And I really feel vindicated that I think that has been a great way to combine information. Again, MDs have notoriously thought of themselves as the only game in town, and there's a whole lot of other healing concepts and ways of thinking about illness in the body out there that need to be embraced. And I love that Jill and I are integrating these methods without setting up a me against you concept. It's here's more tools. Find the ones that work for you with your patients. You know, a lot of people have asked me over the years, we need an algorithm to treat mold toxicity. And I've absolutely refused to do that because there is no algorithm. There's individual patients who are biochemically and genetically unique, and we need to treat each patient from that perspective. I know that if I put out an algorithm, people would be blindly using it on everyone without really thinking about, does that fit for this person? I don't think we have a fit here. So that's just the way I look at it.
Yeah. Well, I noticed on your website when you're offering consultations with people along with their practitioner, but you have some requirements about that practitioner. In particular, you don't want them to necessarily come with their own, rigid algorithm around mold detox. I think that's
It's true. And
well.
I set that up for the same reason I set up the mentorship program, is I thought I could help more people understand this by doing consultations with the patient and with their treating physician on a Zoom call, so that I'm not only helping the patient, but helping that healthcare provider understand how to do this. I thought I could do better teaching that way than just sitting in my office working with the handful of people that we have time for there. So about 3 years ago, I let go of my clinical practice, and since really focused on doing these consultations, which have been, I think, very helpful.
Yeah. Well, I mean, it sounds like you are getting a lot of people to take advantage of it. And that's a testament to things are changing. If regular allopathic docs are willing to sit on a Zoom call and learn from Gandalf about these esoteric, mysterious, humbling disorders. I mean, these are kind of syndromes that make doctors quake in their boots because they're not equipped in medical school or residency to sit with not only the uncertainty of what this is, but to really understand how to deal with it.
Well, it's not being taught in medical school. So they get out into the real world and they go, oh my goodness, there's a whole lot here that I thought I was going to learn how to treat everybody who walked into my office when I got out of medical school or my residency training. Sorry, this is a lifelong commitment to learning, boys and girls. It's we didn't have this when I graduated from medical school. None of this. I mean, the word holistic wasn't a word. It was so not all physicians are aware or recognize that they're going to have to learn for the rest of their life if they're going to be good at what they do. And the current medical system is so broken that those physicians are near burnout because they're being asked to see patients and a time frame that's not conducive to really getting a full history or doing a physical exam, really getting to know that patient. Then they have to spend hours after their day is over charting this in their electronic medical record and getting it right. And physicians are burning out over it. It's not fun. It isn't fun when you know you're not helping people and don't have the time. So, I mean, forgive me, but as an ancillary comment, our medical system is truly broken. It really needs a major overhaul so that physicians can have the time to be with a patient and listen to them so that they can actually make a good diagnosis and not go, well, our 7 minutes is up. I'll see you back in 6 weeks, having accomplished nothing during this visit, except maybe writing a prescription for something that would be a Band-Aid, because we certainly haven't gotten to root cause.
And documentation, don't forget documentation. A lot of boxes have been clicked.
Right. One of the words that I hate the most in this world, and it's so overused, is evidence-based medicine. And the reason I hate it is because a lot of people don't understand that the evidence is incredibly weak on which we're basing it. If you ever do a deep dive into any medical research, you will realize that researchers agree about almost nothing. And so what they'll do is they'll take a dozen badly done studies and make that into something that is now the evidence. And it's like taking really faulty information, poorly thought out, poorly put together, and now this is the standard by which all doctors need to practice. So, I mean, forgive me, but I've got on my little soapbox. I hate the concept of evidence-based medicine because it is basically a fallacy in concept.
Yeah, no, I totally agree. And it's become almost a way of bullying, young doctors who are trying to think and be curious and ask good questions out of, it sort of bullies the curiosity out of them because they're slammed with this, well, that's not evidence-based. And the sort of the underlying sort of threat is, you're not actually capable of being a doctor in the right way. You're not smart enough. You're not competent is kind of the underlying message
Right.
there. Doctors get scared out of thinking outside. I mean, and evidence is such an interesting word, right? Because what people really are saying when they're talking about evidence, they're talking about published literature, published
Right.
literature, which is funded by, drug companies for the most part. And they're not looking at any of the other vast repositories of evidence we have, often staring us in the face in the form of a patient who got well with a given treatment, right? That's a form of evidence.
It is to me. I often will say, my evidence is the over 4,000 people with mold toxicity that I've helped recover their health completely. That's my evidence. And if you don't think that's enough evidence, I can't help you with that. It seems to be helpful to a whole lot of people. But if no, I don't have that data readily available because I didn't have the time or the interest in really cataloging all that information while I was getting it. And then if I was going to get it published in a peer-reviewed journal, I'd need to spend tens of thousands of dollars to get an IRB and of my own money, because nobody's funding me on this. And so I don't think that patients fully understand that the so-called evidence has to be funded, and thereby people are coming at it with a bias. They are intending to prove something and they're willing to pay a lot of money to do it, as opposed to good research, which is simply, let's collect data and see what comes out. And that there's not much funding for that.
Yeah. So we've gotten into some really, I think, profound terrain about the medical system. I have near and dear to my heart a couple of young people who are on the path towards medicine. And I wonder if you, with your vast experience and perspective, have any words of hope to offer to the up and coming generation of doctors who are training in the allopathic model and maybe trying to maintain that part of themselves that is open to other things.
I'm an optimist, but it's very hard for a up-and-coming physician who wants to do good and wants to be a healer, who wants all this, to find that in the world that they're going to be coming up in. They're going to be stuck with this evidence-based, fallacious information, being forced to incorporate it into their thinking. And I think that's intentional, by the way. It's to get people to not think. So if you're up and coming and you really want to be in this field, start thinking about taking other courses so that you can nourish your spirit, you can nourish the parts of you that is a seeker that really wants to look at a larger body of information. Find integrative functional physicians to mentor with, to eventually practice with, because the last thing you want when you leave medical school with a $350,000 debt is to be pushed into a situation where to repay that debt, you're going to have to practice really lousy medicine for 4 or 5 years. And unfortunately, that's where a lot of people are being pushed. By the time you're done with that process, you are burnt out, you lost your milk of human kindness and your compassion. And so if you understand from the get-go that these are going to be the forces that are impacting you, you can resist those forces. If you don't understand that, you're going to be railroaded into a system of care that is going to really make you unhappy, and you're not going to like who you are doing what you're doing.
Thank you so much for that. That's really powerful stuff. Is there anything more that we would touch on before we end? Anything, any last words you have for sensitive people trying to find their way back to normal lives again?
Yeah, I want to emphasize the message of we now know what triggers the sensitivity and we know how to treat it. Not 100%, we're still learning about it, but we've learned so much that the vast majority of people who become sensitive can completely heal. I mean, completely heal. So my take-home message is, name of one of my books, Healing is Possible, because it is. So you just need to find the right information for you and work with someone who will honor you, listen to you, take you seriously, and guide you through it. But it's doable.
Awesome. Dr. Neil Nathan, you're such a gift to me and so many others. Thank you so much again for this time and for sharing your words of wisdom and your experience with us here today.
Great. Thank you for having me.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.